Hello, welcome to the Let's Talk Kids Health live show, episode 60. I'm Dr. Nerissa Bauer, your host. I'm a behavioral pediatrician and CEO of Let's Talk Kids Health. As you know, the concept of this show is to share information about behavioral health, parenting, and family wellness. Each week, I bring you topics and guests to help me advance this mission so that we can all talk together. Now, let us know that you're here by commenting, asking questions, saying hello, and liking at any time. And in a little bit, if you have questions, we can ask it of my guest. Now, the replay will be immediately available after the broadcast. Please share this episode with anyone you think who would benefit. And if you don't want to miss future episodes or maybe check out some of my past ones, please subscribe to my YouTube channel, NerissaBauerMD, and follow my blog Facebook page, Let's Talk Kids Health, and join my free parenting discussion group. So, today's topic is ADHD, Culture and Kids with Dr. Panna Patel. Dr. Patel is a third-year resident in general psychiatry at Texas Tech in Lubbock. She is looking to pursue additional training in child psychiatry and has a special interest in ADHD as well as animal-assisted therapy. This is her first children's book that she has published and is very excited to be here. I am excited to have her here too. So, welcome to the show, Dr. Patel.
Hi, Dr. Bauer. I'm so excited to be here.
I will just share this story first of all before we go into it. I'm always on different social media channels and Facebook groups. And when I came across the fact that a psychiatry resident wrote and published a children's book, I was like, I have to meet her because residency in of itself is very challenging, time consuming. And the fact that you went out of your way to take the time because you're passionate about this and you wanted to get this out there is so amazing and impressive to me. So congratulations, first of all.
Thank you. Thank you.
Yeah. And I don't know. Could you just share okay, here you are, resident, working a lot of hours, and then you're like, I need to also become a children's book author?
Well, it was just something that was in the back of my mind for the longest time. And honestly, you're right, residency is very difficult. But then I just last March, I broke my ankle and I was like, I have this time now to sit here and actually do this. And so I just put in words. I used to write poetry and it just came out. And I was like, maybe I should gear this to psychiatry, and had a lot of mentorship happen through all of the process. And it was just great. So I'm excited that it actually worked out.
So you made use of the time while you were healing.
Oh, yeah. Yeah, we can't just sit still. It's hard for us to sit still.
Oh my goodness. Oh my goodness. Well, that is so wonderful and good. Congratulations. So hopefully this is the first of many different endeavors. And what a great story, because you said you used to write poetry. So interweaving that skill on top of the fact that you're now, learning and becoming a psychiatrist, right? Putting that all together just gives you a unique perspective to become a children's book author, to write this book. So without further ado, let's just kind of talk about this. So what was your inspiration for specifically this topic? I get that you were kind of confined in your house, healing from this injury, but why ADHD? And, how did you come across, to that viewpoint?
So I worked a lot with ADHD kids when I was doing the child clinic over here during my rotations, and they are just really amazing kids. They're funny, they're sweet. The moms are always great too, and they're like, "Oh, I don't really know," or why my kid's acting this way. And it was a population that really, really drew me. And combined, like you said, with the poetry aspect of things and me wanting to write a book in general, I just felt like they just worked well together. And so my inspiration was essentially just seeing this population specifically in action, and just sitting there with my fractured ankle, like, well, I can't sit still, so now I know how they feel. So it just came together in that way.
Oh my goodness. I love it. And what I will tell you, because as you know, I'm a behavioral pediatrician. I see a lot of kids with ADHD. I have a course called Teach Me ADHD, but it's geared for kids 8 to 12. I get the question all the time. Okay, so Dr. Bauer, we have a diagnosis, but my kiddo is 3, 4, 5. How do I explain to them what ADHD is in a way that they get it? And for those of you who have followed me through the years, I love children's books as a way to open that conversation. So again, when I saw your post that here you are, a psychiatry resident and a children's book author with this book, by the way, this is what it looks like if you haven't seen it, The Busy Bee in My Head. It's great. You need to check it out. um, but I thought, wow, I'm going to add this to my short list of books that I offer to families with this question, like, how do I sit down and start that conversation? I think it's so important to bring those kiddos in.
Oh, yeah, for sure. When I was going through the book and kind of just having to sit still because, any movement, I couldn't do, I was like, it feels like there's a bee in my head that just keeps buzzing and wanting to do this and wanting to do that. And then I have to do this and that and this. And so that's where that metaphor came from. And, some of my psychotherapy colleague before was like, you have to use metaphors. And I'm like, that's the thing I suck at. I can't do metaphors. And then I came out with this book and I was like, never mind, I guess I can. So, yeah, I just felt like the bee was probably the best explanation for me, for myself. And, what I'm getting from other people is that they also are like, oh, yeah, no, who would have thought a bee would be the metaphor for this?
Yeah.
So.
Yeah, no, I love it. And I will tell you, I am very familiar with what's out there. I have not yet seen a busy bee as, kind of that metaphor. So I love it. So let me ask you this question. Like, how does that main character resonate with your goals for psychiatry?
Yeah, so like you mentioned, ADHD was geared for you from 8 to 12. So for me, I was looking at kind of the 7 to 12 age group because, ADHD diagnosis kind of happens around that time. Very fluid age, though. So for me, the main character, I actually didn't think about, because I was just writing at that point. I didn't think about how I wanted the main character to look until my illustrator specifically asked me, what ethnicity did you want this kid to be? And I was like, I just thought it was words. Like, what do oh man, like I'm doing an actual children's book now. So I was like, let's make him a South Asian boy. Because in my practice so far, from all of the kiddos that I've seen, it's been very rare that I've seen a South Asian kiddo come into the office for ADHD management. But I know quite a few of them that probably need to be, So that's kind of the goal that I have for one is, kind of making it more culturally appropriate for, the kiddos that I see that, other people don't really see. Maybe the parents will see the book and be like, hey, this is probably my kid or something like that. But also, there's medication management, things like that, just normalizing treatment for both adults and even children. So that was kind of the goal that I had when I started creating this book is how are we going to make this for both age groups. So
Yeah, and relatable. I think that is such a big thing because I'm really glad that our society is recognizing the importance of this and acknowledging that we are a country filled with so many people of different skin color, religion, cultures, all of that, and we should be embracing it all. And the fact of the matter is, this book, what I really loved about it personally, is that again, your character has a skin tone that's different than other books, right? You have characters in here. I'm not going to, because we're going to talk about this. We have characters that, reflect different cultures too. And again, when you think about a young kiddo in your practice who picks this up and says, oh, that's me. Oh my
yeah,
gosh. Like that aha moment is so important. I mean, I think that's why what I love about my class, because it's an interactive Zoom class, typically I tell kids and parents, kids don't go up to each other and say, hey, do you have ADHD? No, we do not do that. So oftentimes our kids don't have the opportunity to really engage with kids just like them who think and learn a little bit differently. So in my class, we have a safe space where then all of a sudden they're seeing kids on screen that have ADHD. They're learning that they have ADHD too. And they're like, oh my gosh, like I'm not very weird or I'm not different from this person or that person. It just feels so validating and so accepting. And this book I see can do that for so many kids.
that's a hope. It was so much about normalizing this. Like, hey, now there's something out there that it looks like you. It's a boy like you. There's a 7-year-old. There's a book. There's a dog. Like so. It's all of these things that I wanted to put together so we can normalize psychiatric care for a kid. Because a lot of times you see these kids in the hospital setting or in the outpatient setting, they're like, I don't want to see a psychiatrist. I'm not crazy. And it's like, that's not what we're treating here. I hope you know that this is a very normal diagnosis. It's really common, and we just want you to get the help. So
Mm-hmm.
I'm glad.
Yeah. Yeah. So, in your kind of thinking through this, what aspect of this book, again, like I said, there are lots of other, like, there are not a lot, but there are some other books out there for kids to learn about ADHD. What aspect of this book actually helps it stand out from others?
I think the big thing that I wanted to portray in this book was the medication management aspect. So there's a page in the book. I'm not going to get through everything, but there's a part of it that's one of my favorites. It's where the mom is giving the kid a little pill, and he's like, the busy bee like is always there, but he calms when he gets this pill, and kind of just incorporating the fact that, hey, like, it's okay. You can still play, you can still laugh, you can enjoy things. But you're going to have to take this medicine to kind of help calm things out and be a little bit more functional. And that bee will always be with you, and that's okay. But so that medication management aspect of things and normalizing, hey, it's okay to take this medicine was a really, really big, important factor, because that was not really something that I saw in any of the kids' books that I was looking at. Maybe there's so many metaphors for what to call this, but not necessarily how do we treat this or what is this pill that this random doctor is giving me type of thing. So
Yeah. Yeah. I mean, I think that's really important because after we make the diagnosis of ADHD, obviously we want our kids to be able to process and voice their opinions on treatment, right? Can we just kind of step back a little bit and kind of think through a little bit more about culture as it relates to ADHD? Because, for any mental health diagnosis, right? Um, there's not a blood test, there's not an imaging study. A lot of it we have to really understand with context, and a large part of it is culture, family values, and whatnot. There have been so much, like, at least in my own personal experience in and in the growing literature about this, like, a family's culture can really influence, first of all, if they're even accepting of a diagnosis, right? Or how they feel about that, how they explain what they're seeing, right? And then also, it also can change whether or not or impact how willing they are to engage in treatment. And so sometimes these kids get diagnosed later. Sometimes they get diagnosed, but then they don't do treatment yet. Or, when I say treatment with medication, they might try other things, which is fine. But as a clinician, we always have to be kind of mindful of what those other things that could be kind of influencing how well a family is able to, kind of engage with us.
and feel comfortable getting the treatment in the first place.
Yeah.
There's a lot of things that, I was thinking about even during the book process and looking at culture and psychiatry. And it was just, we always have all of these widely known researches about this race and this race for this specific diagnosis type of thing. But, every culture, when you actually see the person in front of you, there's still a stigma. There's a somewhat of a stigma in taking medication. There's somewhat in a stigma in having the diagnosis. And sometimes there's not. Sometimes there are people that are super happy to know what they have. And so it's always really it's important to know that and recognize that when you look at your patient population, but also like recognize kind of the barriers that prevent the patient from getting treatment or seeking out treatment. And like, you're a pediatrician, and if I'm going to do child psychiatry for you, also before you refer, it's always important to know what's stopping this patient from seeing child psychiatry and referring out and things like that. And us, when we see kiddos, it's always important for us to also recognize, well, it was a big step for you to come here into clinic today, wasn't it? And just acknowledging that. So
Can I just say I'm so like, when you said that, I was like, oh my goodness. I am imagining if families, heard that from their specialists, their psychiatrists, like, just that acknowledgement that it took some work to get there. Like, I mean, it is so great to hear that. I mean, it is hard work, especially when you're stressed and you're just trying to figure out the next steps for your
Mhm.
kids. And especially if you're still learning yourself. I mean, there is, some families who may know what's going on and they might have read, they might have done research, but again, some families don't, and they're just learning just like their kiddo is at the same time. And it can be really scary. It could be overwhelming. And to have a physician or a specialist talk to them in that way, I imagine can put them at so much at ease.
Oh, yeah, that's the hope. I hope so whenever we say that. So,
Yes. Yeah.
but yeah, no, I'm glad that that was phrasing that you appreciated.
I do. I do. And I
Like
think,
the word.
yeah, no, and I think a lot of families who are watching, like, right, if you're watching this now and you appreciate that, I mean, just let us know, because I think that's really great way to, make sure that we're all on the same team, right? And I mean, I think families looking for help just want to know that they can, first of all, are heard. And you're right. I mean, there's a lot of stigma, a lot of barriers. And at the end of the day, when you're sitting looking at this family, you need to kind of make that relationship so that you can understand, okay, I understand now how this is affecting your child. Let's understand where you want to go and how we can get there. Right.
Mhm.
And again, that normalizing too. So
Yeah.
I love it. I love it. So, but just as a comment, I mean, again, we mentioned that culture can really color whether or not a family is accepting of a diagnosis, how they feel about treatment. And it really behooves us as clinicians, when we're meeting families or therapists at school, educators, to really try to walk in families' shoes, and to really sort of just meet them where they are. Because again, sometimes it takes time to kind of help them kind of figure out what makes sense for their family. But I think always communication is at the heart of that.
I think we're also still learning about how to explain diagnosis type of things.
Yes.
One of the biggest things that I noticed also was some language barriers sometimes. Like, even if we could somewhat speak English and somewhat, not speak some other language, using the words like psychiatric terms like ADHD, what does that even mean? And so kind of having to explain it to even adults that have language barriers of how can I just, even if they speak English, like, it's so hard to explain what does this actually mean. And so the book was hopefully a good explanation for kids and adults, and I hope it came out that way because I know my mom read it and she was like, oh, this makes sense now what you actually do. I was like,
Oh,
thanks.
I love it. I love it. Yeah. And, I think it is. And again, I think that part of the challenge is, a lot of information, Panna. You're right. I mean, you've got your training, and, with every field, we have our own language and terminology and big words. And really, to write a children's book, first of all, it's not like wordy and extensive. I think the fact that you wrote poems before, it really helped. But like, even distilling down that information from up here and then figuring out just simple, easy, understandable language that even a 7-year-old could read and understand, right? Or be read to and understand. It takes a real skill. So when I read this, I was like, okay, this is on my short list, because it is such a great book. So if I haven't convinced you yet to check out the book, it's on Amazon, The Busy Bee in My Head. There you go. It's really beautiful, beautifully illustrated. And it's just really great. So go out, buy it, and post a review to Amazon, because that helps other families find the book. And, I mean, I think that's part of what I just loved about it, is that here you are, physician in training, and resident psychiatry in training, and then also becoming and spending extra time to do this for families. Because again, I think it's such a valuable resource. So
Thank you. I
yeah,
appreciate that.
yeah. So in addition, so it's on Amazon, right? That's where they go to
Yeah.
buy it. Do you know if you're eventually it's going to be available in libraries or?
I'm not really sure what that process would look like.
Okay.
If there's anybody that wants to put it in the library, I'm more than happy to. talk about it, but I don't really know how Amazon does it. So
Yeah, yeah. Well, you're just learning through this
I'm just
process.
learning.
So
It's the first time for me. So
hopefully, if somebody's watching this and knows how to get into libraries, you can tell us. You can reach out to Dr. Panna Patel because, again, the more people that can get access to this book, the better. All right. Well, thanks so much for sharing your time, Panna. It was so great to kind of
thank
chat with
you.
you, share this resource to families. I do want to remind everybody that my next week's guest is Dr. Tanya Altman, who is also an author of many, many things. She'll be coming on the show to chat with me about how to ease kids' worries about current events, which I think is really timely. We're going to be chatting with her on that next week. So make sure to tune in next week at 2 p.m. Eastern Time. And the replay will be automatically available. And if you have another topic or guest that you want to recommend to me, please email me at drnerissa@letstalkkidshealth.org or follow me on my channels and then message me there because you'll find me everywhere. And just as a quick reminder, I mentioned my Teach Me ADHD course, currently enrolling now. Agency doors are now open until Sunday, March 13th. Act now. It's going to close then, and then it won't be offered again until September. If you want more information, go to my website, letstalkkidshealth.org. And I do have a mini class simulation for families who are like, it's a Zoom class. Are you kidding me? I don't know how my kid will do on Zoom. Well, I have a free mini class simulation where kids and you can meet me. I'll run it kind of like I do a training mission meeting. And you can kind of see for yourself how engaged your child is. Your child can meet me, ask questions. You can ask questions. So make sure if that's kind of in the back of your mind and keeping you from signing up, go check out my mini class simulation, sign up today. All right. And then again, as always, it was so great chatting with you, Panna. Thank you again. And I hope you guys will all check out her book.
Thank you.
All right. See y'all later.